We are back on MorningLine. Thanks, everyone, for joining us. We're on Facebook at newschannel5.com if you want to join us there. We're also on the Plus. We've got some phone calls and comments. I see on Facebook a lot of folks, there's still, it's a much smaller group of folks questioning the efficiency and effectiveness of masks. I want to be clear first in terms of the constitutionality and your constitutional rights. Look, already the Attorney General in the state of Tennessee and in many other states have ruled on this and said in a public health crisis, a mandate for masks can constitutionally be enforced. It is not a violation of your constitutional rights. Wearing a mask for a short period of time until this passes, is it that big a deal? But second of all, there are some still saying, doctor, that, does just a cloth mask really make that big a difference? Now, to me, the way you described it earlier, I think I understand it on its front. If I am like this and I have COVID and I sneeze, all those droplets are flying out. If I'm wearing a mask and I have it and I sneeze, much of it is captured. That seems pretty much common sense. Can you explain to folks who still, for whatever reason, have their doubts about masks, okay, why it truly is something that helps here?
Yeah, I am so glad that you asked that question, Nick, because I think that's really an important point that needs to be clarified. So the reason we have this pandemic, the reason there's over 100,000 cases diagnosed in Tennessee, over 20,000 in Davidson County, is not because the pandemic is spreading from one person with symptoms of a cough and sneeze to another person who then develops a cough and a sneeze and becomes contagious. Those events can happen, although largely people with symptoms of COVID-19 are staying home or are in the hospital and are getting tested and staying out of play. The biggest problem that keeps fueling the spread of this pandemic is spread from somebody who does not know that they have the infection. That can happen in two different ways. First of all, the majority of people who get COVID-19 develop symptoms, but for about 2 to 3 days before their first symptom, they're shedding a lot of virus in their breath. Their airways are churning out a lot of virus. We call that period before symptoms start, but after infection has happened, as the pre-symptomatic period. And we think a lot of transmission occurs in that pre-symptomatic window before people have any idea that they're infected. The other thing is that a minority of infected people, it's probably close to 1 out of every 5 people, but it may be as much as 2 out of every 5 infected people, don't develop any symptoms at all. Those infected individuals can still shed the virus. They don't shed as much virus in their breath as someone with symptoms or someone who's about to get symptoms, but they absolutely can transmit the virus to other people. So it's this silent spread that is so devastating to keeping this pandemic alive. And so what we've learned is that the main way that this virus is transmitted from a person to another person is when people are close to each other and the person who's infected and may not know it is breathing next to them for a prolonged period of time, and that person next to them inhales their breath. The virus travels in relatively large respiratory water droplets. And what do I mean by that? Well, if anybody has breathed in front of a window or a mirror or their glasses, and you see that mist or fog that forms on the glass or the mirror, it's in that water droplet mist. You can't see it normally unless you hold up a piece of glass, but it's in those droplets that the virus largely travels. And when we breathe, we don't even need to be sneezing or coughing or singing or shouting, but just our normal breathing and talking creates a mist or a cloud around us that can contain this virus. What we've learned about fabric face coverings, cloth masks and cloth face coverings, is that they very efficiently block that cloud from forming around us. They trap these respiratory water droplets and prevent them from really going out. They're not 100% perfect. They don't keep every single droplet from our breath from going out, but they're very good at doing that. And so the reason that we want people to wear masks is at a time when we can't tell who's infected and who's not. And we know that there are a lot of people walking around interacting with each other who are shedding the virus, but we don't know who those people are. So the best way to try to reduced risk of transmission events is for each of us to behave as if tomorrow we're going to get symptomatic, and today we're asymptomatic or pre-symptomatic and we don't have symptoms, and I want to protect the people around me by wearing a cloth mask. And we have absolutely now have evidence, real world evidence, that wearing these masks in concert with social distancing and hand hygiene, all of this absolutely reduces the likelihood of transmission events. So I think that's the main point. And as we've seen more and more people participating in what is really a simple and very safe way to protect others, we're starting to see rates of disease fall.
Yeah, the proof is what we've seen just the last couple of days. And again, yeah, I wear this not so much to protect myself, but to protect others, because I don't know for sure day in, day out, even though I've been tested once or twice, whether or not I'm a carrier. And so I want to protect others. That's why I wear one. All right, let's go next to Fran. Fran, good morning. Hi, Fran. Do you have a question for the doctor?
Yes, I would like to ask the doctor a question.
Okay.
About the testing. I don't need to be tested because I'm okay now. But what I'm asking is, in February, I got so sick. That was before I knew anything about coronavirus. I got so sick, I thought I was going to die. I thought, cause I have a real bad allergy problem. And I called my doctor. He told me to go to the drugstore and get something. By the time I got to the drugstore, I didn't remember what she said.
It's interesting. I know where she's going with this, and we didn't have a clear, connection there. But Doc, yeah, there are some folks out there that before we really knew early on this year about COVID as much as we do now, they got really sick and thought, hey, I think maybe I had it back then. I know a few people that felt that way and went and got tested and didn't show up with the antibodies. So what do you think? I mean, in some of these cases where folks got really sick at one point, maybe before the tests were available, and wonder, could they have had it?
Yeah, Nick, that's such a good and common question. I get a lot of questions from friends, colleagues, and patients saying, hey, I had some kind of flu-like illness in February or March or April. I never got tested for COVID-19 because at the time I was sick, we didn't know about it, or testing wasn't available, or my symptoms were mild and I just didn't know. So how do I know if what I had back then was COVID-19? And I think that really gets to Fran's question. It sounds like she suffered from an illness in February. And this is the thing, is we would love to be able to have a blood test that would tell us without question whether an illness that someone had in the relatively recent past was COVID-19 or not. And the go-to test is generally an antibody test. Antibodies are proteins that are found in our bloodstream after we get an infection. They generally take a couple weeks or longer to be produced at the level where we can detect them. But it's by measuring those antibodies that we can sometimes say, yes, you have had or you have not had an infection in the past. But things are a little bit tricky, we're learning, with COVID-19. First of all, we're finding that not everybody who gets infected with absolutely bona fide COVID-19 ends up mounting an antibody response that's strong enough that we can detect it in their blood. It does not mean that they're not protected from a new infection, but for whatever reason, we can't seem to detect antibodies circulating in their blood. The other thing is that even in people who were sick enough with COVID-19 that they had to be in the hospital, generally those patients, we are finding antibodies in their blood, but those antibodies don't always stick around for a long time. And after several weeks, the levels in the blood can recede so that a blood test looking for those antibodies is now negative. Again, it doesn't mean they're not protected from infection, because the levels of antibody in the blood may not be a great predictor of protection. But all of this adds up to the point that a positive test on an antibody test in the blood is suggestive that someone's had the infection in the past, especially if they had an illness that was compatible with COVID-19. So if somebody watching this or listening in remembers, I had something like COVID-19 in March and my antibody test is positive, They probably did. But if their antibody test is negative, they may not have.
Okay, so and that's the question then for folks. I mean, is it worth, if you've recovered and you're better now, going and getting an antibody test for any reason? I mean, is that a big deal? Should you go if you think you had an illness that maybe sounds like it's similar to the symptoms of COVID, maybe 3-4 months ago?
Well, I would say that I probably would not advise that for 2 reasons. One is, if you test positive, it may shed some light on what you had before, but it does not tell us for sure that it doesn't tell you that you can't be reinfected. So, for example, we're pretty certain, based on the fact that millions of people have had COVID-19 around the world, that getting a symptomatic reinfection with the virus, at least during this first year, is uncommon. So if somebody has recovered from COVID-19, they are unlikely to get symptomatic COVID again. But it doesn't mean that they can't get infected and still transmit the virus to other people. And here's what I mean by that. When we get a flu shot every fall, hopefully everybody listening and watching gets a flu shot every fall, but when you get a flu shot, it doesn't prevent you from getting the flu. You can still get infected with the flu virus, but it protects you from getting seriously ill, and it shortens the duration of the illness if you get symptoms. But you can still transmit the virus to somebody else, even if you've been vaccinated. If you get infected with influenza, you can still transmit it to someone who's not been vaccinated or is susceptible to the infection. It's just that you're less likely to do that because you may not be ill for as long. So when it comes to COVID-19, if somebody gets a positive antibody test and says, oh, I had COVID, or they get diagnosed with COVID and they recover, they should still be socially distancing, wearing masks, and participating in hand hygiene, because they could still be part of the chain of transmission if they were to get infected. And then the other thing is that if I test positive for antibody, it doesn't necessarily mean that I can get off scot-free and I don't need to protect myself from getting reinfected. And of course, a negative result does not absolutely rule out that what they had in the past was COVID. So right now, a lot of people are getting antibody tested, but I'm not sure that that's really the be-all, end-all of understanding.
Okay, listen, we're going to take a break. When we come back, we have questions here. I want to give you a chance to address some who still question the numbers that are out there. And I think in general, the numbers that come out there are accurate, but there have been reports sometimes of false positives being reported as positive, and how it's tabulated, and some out there thinking, well, it's being blown into more than it really is, and give you a chance to address that, as well as the question about when vaccines come into play, and the confidence people should have in them when they finally do arrive. I know one of your colleagues there at Vanderbilt, Dr. Schaffner, has talked about that and how he expects them to be safe when they do go to market. So let's take a break. We'll be back with more with Dr. Aronoff at Vanderbilt right after this.
This is a Storm 5 weather update. For weather on the go, down